Good evening, everyone. So, my next video, which I'm going to discuss with you, is on the MBS new CBME pattern, the PH 5.6, that is educate public and patients about various aspects of drug use, including drug dependence and over-the-counter drugs. Basically, in this PPT, I will discuss in this video, I will discuss with you the over-the-counter drugs and drugs which cause the drug dependence and how we educate the public and the patient about regarding the use. So, I'm going to start. And before I start my video, I want to request you, if you like this video and if it is helpful to you and if it is useful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. Now I'm going to discuss with you various aspects of drug use, including drug dependence and over-the-counter drugs. Now, first of all, what are the over-the-counter drugs? These are non-prescription drugs or medicines sold directly to the consumer without the requirement for a prescription from healthcare professional, as opposed to the prescription drug which may be supplied only to consumer processing of valid prescription. Means these are the non-prescription drugs, means this can be given to the consumer even without the prescription slip of the healthcare professional. Means the pharmacist or the dispenser can give the drug with or by the verbal communication to the patient without any prescription slip. But the prescription drugs, on the other hand, they require a valid prescription for the consumer to take that drug. Example: some vitamins like multivitamins, they can be given by the as the over-the-counter drug. Antacids, they can be given as the over-the-counter drugs. Analgesics such as aspirin and paracetamol, these can be given as the over-the-counter drugs. And these are selected by the regulated agency. With these over-the-counter drugs, these are selected by the regulatory agency to ensure that they contain ingredients that are safe and effective and used without a physician's care. Means the ingredients of the drugs, they are checked by the regulatory agency to check for the efficacy and safety of the drug, so that we can make sure that the drug can be given without the physician's care to the consumer. Over-the-counter drugs are usually regulated according to the active pharmaceutical ingredient rather than final products. These drugs, these can be usually regulated according to their active pharmaceutical ingredients rather than the final products. Some drugs may be legally classified as over-the-counter but may only be dispensed by a pharmacist after the assessment of patient's needs or the provision of patient education. With some drugs, they can be given by the pharmacist or the dispenser to the patient just after looking to the patient needs, means whether the patient requires the drug or not, whether the need of the patient is there to take the drug or not. And that pharmacist decides, and then these are legally classified to be taken by the consumer given by this pharmacist as the over-the-counter drug. The trend of over-the-counter medicines use have increased in the last few years. In the last few years, the trend of over-the-counter drugs, it has increased a lot. Why? Because of the easy availability of the over-the-counter drugs, affordability. The public, the cost is less, so public can easily afford that drug, and there is increased awareness among the patients, which is responsible for this trend. Because there is increased awareness, increased availability, increased affordability among the patients, which can lead to increased use of the over-the-counter drugs in the patients nowadays. In India, till date, there are no guidelines for licensing of the over-the-counter drugs. Because there have been no guidelines for licensing of the over-the-counter medicines, and there is no separate category allotted for the over-the-counter medicines, and the drugs which do not come under the prescription medicine schedules are generally sold as the over-the-counter drugs, which do not come in the prescription list. In the prescription list, the drugs which do not come, there is no separate category which is allotted to the over-the-counter drugs. These are just non-prescription drugs, and these are sold as the over-the-counter medicines. Now, what are the advantages of the over-the-counter drugs? This is the First of all, there can be satisfaction to the consumer after taking the over-the-counter medicine, and it reduces the burden to management of the hospital. Now, in hospital, a lot of doctors, they are seeing the patients, and there's a lot of patient overload, and the hospital is running a lot of departments. So there is basically a workload in the hospital that can be reduced by the use of the over-the-counter drugs. And they can be reduced workload on clinicians as they need not bother about the trivial problems of patients like pain or weakness in the body. We give vitamins or antacids for any gastritis in the gastroesophageal reflux disease or peptic ulcer disease. Means for the trivial problems, we need not give the prescription to the patient, and they can reduce the workload on the clinicians. Obviously, there can be profit to the pharmaceuticals. That is the there will be profit to the pharmaceuticals. But disadvantages is these aspirin, which is the analgesic drug, it can cause idiosyncratic reactions leading to gastritis and even bleeding from GAT. They can lead to gastritis, and they can also cause the bleeding from GAT as a side effect. And when in children, when we use the aspirin, it can lead to Ray's syndrome. And the aspirin, it may also precipitate asthma, bronchial asthma in the sensitive individuals. And pill toxin, which inhibits the tubular secretion, it may block the action of levodopa. It is a multivitamin tablet, and it can block the action of levodopa, which is used in the patients of Parkinson's disease to treat the Parkinsonism. It can block the action of levodopa when we give pyridoxine as the multivitamin. Toxicity may result such as overdose of paracetamol in the children. Now, overdose of paracetamol can occur in the children if children they get overdose of paracetamol. More tablets are given for analgesia, so that can lead to toxicity. Now, drug dependence. What is drug dependence? This is the abuse of drugs and chemicals is a major concern of our society today. This has always been the desire of men to alter his consciousness. Because why they take the drug dependence? Why they do the drug dependence? Why? Because they get drugs, they alter their consciousness, they pleasantly distort his perceptions and seek pleasure by transient exclusion of reality and to get intoxicated. So intoxicating drugs are defined in a broader sense than the traditional medical one. Now, traditional drugs, these are a drug is a substance other than those required for maintenance of normal health, which by its chemical nature alters the structure or function of a living organism. Now, which are the drugs which cause drug dependence? As I've already discussed in the previous video also. These are the CNS depressant drugs, CNS stimulants, and distorters of consciousness and perception. CNS depressants are opioids, like non-medical use of opioids for clearly pleasure-seeking purposes. And hypnotic sedatives are prescribed sleeping pills and daytime sedatives. So alcohol can be to for the pleasure seek, to reduce the to alter the consciousness, to seek pleasure. We give the alcohol. CNS stimulant drugs, these are the antidepressants used for the relief of emotional depression, and in normal non-depressed people, they have this stimulating effect. But act as they have no stimulating effect, but they act as mild sedative. With a normal person, they will act as mild sedative, and there will be no stimulating effect on the patient as the antidepressant drugs. They are used for the relief of emotional depression. And vitamins, these are given in narcolepsy and treatment of hyperactive children. Cocaine is the topical anesthetic. Distorters of consciousness and perceptions, hallucinogenic or psychotomimetic. These are LSD, mescaline, psilocybin, cannabis. These are distorters of consciousness and the perception. And these are also known as hallucinogenic drugs or psychotomimetic drugs. The public education regarding use of this drug dependence and the over-the-counter drugs are various means of various aspects of drug use, including The drug dependence and over-the-counter drugs can be given. Education can be imparted by the dedicated doctors, like doctors in psychiatry department and community medicine doctors. They can educate the general public regarding use of drug dependence. Means what are drugs which cause the dependence, what is their withdrawal symptoms, how we treat the dependence. All these education should be provided. That what are the harmful effects of taking the drug as the drug dependent drug or over the counter drug. The community medicine people and the other experts, they educate the general public about it. And patient education, there should always be good communication with the patient, and he or she should inform each and every details of the disease from which he is suffering and relevant details of medicines prescribed. Means what disease he is suffering from and what all the medicines which can be prescribed to the doctor. The general information should be given to the patient. Is which disease is suffering from, what are the signs and symptoms of disease, what is the mechanism, side effects, uses of treatment, and how the relevant details of medicines has to be told. Patient may not take the drug, take wrong drugs, and the patient, he may not take the drug, or he may take the wrong drug, or he may take the wrong dose, or also take over the counter drugs without consultation and without informing the clinician. That may also cause when they take the over the counter drugs without informing the clinician or dispenser, or without the consultation, there can be many drug interactions and adverse effects can, a lot of adverse effects or regarding the use can occur, and the drug interactions can occur when they're taking the over-the-counter drugs without consultation. Now, patient education should be given by the clinician to the doctor. So, thank you. That's all for over-the-counter drugs, public education, and patient education, and drug dependence drugs. I hope you like this video, and if it is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel. Let's talk to Nitika Pharmacology Discussion. I hope you like this video. Thank you. Be happy, be healthy, be safe, be blessed. Thank you. Happy learning. Thank you.